What's up and welcome to Medical Myths. On this show, we are debunking common health misconceptions. On this episode, we're going to discuss Accutane. I'm blessed to have Dr. Mudgil with me. This is a board-certified dermatologist, dermatopathologist, AKA the Gary Vee of dermatology. And today we're talking about Accutane. There's a lot of misconceptions and misunderstandings out there regarding this drug. A lot of fear and stigma behind it. So I'm bringing in an expert and we're going to totally debunk Accutane. So Dr. Mudgil, tell us a little bit about this drug.
All right, so Accutane is basically vitamin A. It's an analog of vitamin A. When we treat patients with Accutane, we're basically inducing a very low level of vitamin A toxicity in their system. And the reason why it's so effective is it basically dries up your sebaceous glands, which are very responsible for, or a key component in the development of cystic acne. So hormones interact with oil glands and it causes this inflammatory process which causes cystic acne. So for our patients with really bad cystic acne that scars, Accutane is like a silver bullet. It's a magical drug. It has serious side effects that need to be respected, the most important of which are birth defects in women who are exposed to Accutane if they're pregnant. A lot of sort of safety mechanisms are in place to prevent that from happening. We have to document 2 negative pregnancy tests before any female patient starts Accutane. We check pregnancy tests throughout Accutane, and we also check pregnancy tests beyond the Accutane treatment period. This basically ensures that our patients are not pregnant while they're taking Accutane. They also have to be on 2 forms of birth control while on Accutane or abstaining from having sex. For our male patients, what it means is they should not donate blood while they're taking Accutane or for several months thereafter, because you would never want a pregnant woman to get Accutane tainted blood. God forbid she needs a blood transfusion. That's really, there's a whole bunch of other side effects that are associated with Accutane, but for some of my patients, it's the only choice. What I tell all my patients with Accutane, it's like 6 months of pain for a lifetime of gain. Your lips get really chapped during Accutane, you'll be a little bit more sore after you work out. There's a few other sort of nuisance-y type things that happen when you take Accutane. But at the end of it, you're free of cystic acne, which can be so debilitating for so many of my patients. I mean, some of my patients don't even want to go out or don't want to meet their friends or don't want to go on a date because they have like really bad cystic acne and they're very self-conscious about it. For that subset of patients where Accutane is such a debilitating problem, there's nothing else that really can help them. It's really, the side effects, yes, they're serious and they're real, but when you're under the care of a board-certified dermatologist or someone who's very capable of administering this medication, has a lot of experience in dealing with the various side effects, it is a wonder drug. And it's really a shame that so many of my patients are so afraid to go on it because sometimes that's what you really need to get your skin to the next level and to really get over a significant medical problem that can cause a lot of mental distress too.
Yeah, I was, actually as a kid, I had severe acne and I did a round of Accutane and it was a miracle drug. And I'm hearing all the time that people are scared of it because of all of these reports of depression, hormonal changes and whatnot. But it really is a miracle. And right now, to my understanding, we don't have anything better.
Yeah, there is nothing better. And the truth is, any side effects that you have on Accutane, they're transient. It's just while Accutane is in your system. So like the chapped lips, the dry skin, it's tough on your liver. You can't drink while you're taking Accutane. The fats in your blood will elevate. But that's all while you're on Accutane. We monitor that stuff very closely to make sure nothing bad is happening to our patient. Making sure that they are safely coursing through the treatment. And then when you're done, everything goes back to normal, except you don't have cystic acne anymore. Yeah. So it's magical. You were with me this morning. We had 2 or 3 Accutane patients that we saw this morning. I'm not saying it's the right drug for every patient, but for some patients, it's the only drug that can really help them.
Yeah, it works and it's one round and it basically clears up your acne for the next...
Forever for some patients.
Forever.
For most patients.
Can't beat that. So the moral of the story is patients should not be scared to take Accutane if they have severe refractory acne.
Yeah, exactly. And your dermatologist will give you their best advice. So if you're a candidate for Accutane, not every patient is a candidate for Accutane, but if you're a candidate for Accutane and it's something that can help you and you've been really, really struggling with cystic acne, your dermatologist will guide you through the treatment and make sure you get through it safely and you'll have clear skin.
Thank you so much. Everyone needs to hear that. If you're struggling with acne, Accutane might be right for you.
Absolutely.
There's side effects, but they're manageable, they're transient. And as long as, you're a board-certified dermatopathologist, if you're confident prescribing this drug to your patients, that's what's important.
Exactly.
That's what matters.
That's it, man.
All right, guys, thank you so much for joining us on this episode of Medical Mythbusters, where we debunked Accutane as a bad drug. Accutane is not a bad drug, it's a great drug. And if you really need Accutane or you think that you might need it, see your board certified dermatologist. Dr. Mudgil works here in New York City.
I'm here.
Thank you so much and have a great day. If you like this channel, please subscribe, like this video, show us some love. Thank you. And thank you, Dr. Mudgil, for joining me. This is
Always
a ton
a pleasure.
of fun.
Always a
ton of
pleasure,
fun.
man.